And so I guess I want to find out a little bit from you, in terms of the three biggest public health killers, particularly in sub-Saharan Africa, why is it that we don't have a vaccine yet when this is what's killing more people than Ebola is? And should we be focusing our efforts on finding that Ebola vaccine when maybe our efforts should be focused on what's killing the most people?
May I ask, do you come from the healthcare community, or you?
Yeah, I work for PATH in Zambia on malaria.
So let me start off. That's a great question. So in vaccinology, in the field of vaccinology, what you learn from the very beginning is the best way to make a vaccine is to mimic natural infection with your vaccine without hurting the person. So when you have diseases, as difficult as they may be with morbidity and mortality, that ultimately get cleared by the body's immune system, that's a surefire hint that you're going to be successful in getting a vaccine. Smallpox kills a certain percentage, depending upon where you are, 15 or 20% of people, but the rest of them recover and develop an immune response that protects them from challenge. Measles, the same thing. You get measles once, you're good to go. You're not going to get measles again. The same thing with polio. Most of the people recover from polio. So the proof of concept is that you can do something with the immune system. Now, take HIV. The one thing you don't want to do is mimic the immune system's response to HIV, because the immune system does not handle HIV very well. Nobody of the 70+ million people who have been infected have spontaneously cleared the virus. So the body has a problem in their immune response. Malaria, sure, you make an immune response against malaria, but even if you've gotten malaria once, and if it didn't kill you as an infant, you'll get it again. You may not be as sick, but you'll get it again. Tuberculosis, we still don't fully understand the interdigitation between the immune system and tuberculosis. So those three big killers, unfortunately, it's very, very difficult. Ebola, people recover from Ebola. So you never say never and you never say always in medicine, but I can almost guarantee you that we will have a successful Ebola vaccine, because all we need to do is mimic the body's response against Ebola. And that's really the difference of getting a vaccine or not getting a vaccine. It's the nature of the infection itself.
How long will it take to get that successful Ebola vaccine?
Well, I think Judy, we probably already have it, and we just need to prove that it works. I mean, if you look at the relationship between the response it induces in an animal model, it protects animals very well. We know it's safe. We've tried it in the United States. We've tried it in Africa. We just need now to prove that it actually works. The bad news is we're not going to be able to prove it likely because there are no incidents of infection. Now, the good news is that the infection rate is so low in West Africa that people are not dying in throngs the way they were months ago.